Welcome to Friday's edition of COVID-19. There has been a slight decline in daily cases as we head into the weekend, but authorities are calling for continued vigilance as concerns over cluster infections remain. Also coming up in our program today, we have details on our vaccine drive. But first, here is our Kwon So-ah with the broader pandemic update. Now, So we're ending the work week here in Korea with the tally below 500.
Yes, Sunny, below 500 and also for the second straight day, as well as a decline from yesterday with 469 infections reported as of 12 a.m. But we even could have had a lower number of cases if it wasn't for recent cluster infections related to a missionary training school. So let's jump into the updates linked to the IM Missionary Society. Now, following inspections at some 40 related facilities, there have been a total of 344 COVID-19 infections reported at 7 locations. And on top of that, 30 new infections were also detected in the city of Gwangju, linked to a separate church. Now, cluster infections at homeless shelters have also become an issue because it's not only difficult to practice social distancing and basic hygiene measures, but also since many homeless do not own a cell phone, contact tracing is a challenge too. So that's why authorities decided to conduct preventative screenings once or twice a month. Now, 14 homeless people at Seoul Station, meanwhile, in the capital, have also been confirmed on Thursday. Now, Seoul and Gyeonggi-do province are still dealing with triple-digit figures of infections. And then we have Gwangju here with a surge, again, as I said, related to religious facilities. Now, that brings the total number of cases here in the nation to 77,395, and the death toll is now close to 1,400. And if we take a look at our graph now, in the past week, numbers have been fluctuating between the 300s and 500s. So the government will make last-minute evaluations of this trend before announcing over the weekend whether they will change or not change social distancing measures that will be in effect beginning February.
Right, So. Meanwhile, on the international front, the coronavirus variant from Brazil is causing much concern.
Yes, Sunny, very serious is how scientists are referring to that Brazilian variant. First, due to extraordinary fast rate of the spread there, and also what they described as a particularly dangerous set of mutations. And Brazilian researchers also found 2 different strains in 2 patients in Brazil simultaneously. Now, if we take a look at the numbers, Brazil now has over 9 million infections and has also reported over 60,000 new cases in the past day. And the U.S., meanwhile, which earlier this week confirmed its first Brazilian variant, also reported its first infection linked to the South African variant on Thursday. And the U.S. also had its first death related to a UK variant. So speaking of deaths, the U.S. now has a total of 443,000, more than 443,000 infections. And we see here Mexico with over 155,000 fatalities has surpassed the total number of fatalities in India. And the total number of infections around the world now stands at 102 million, with almost 600,000 new cases reported in the past day. And those are the updates I have for now. I'll be back with more on next week, that is. Back to you, Sunny.
Right, so I'll see you back on Monday. Right, here on the local front, a company has come up with a way to keep workers safe in the office by allowing them to work in relative isolation. I have Chun Song-cho on site. Hello, Song-cho.
Good afternoon, Sunny.
So, Song-cho, where is this company?
Well, I'm at an office in Gurogu District, Seoul. Disease prevention and control at workplace is of paramount importance, especially if you have a desk job. You'll most likely spend the majority of your day inside the office, sitting behind the desk, breathing the same air, sharing the same space with dozens or even hundreds of other people at the same time. But of course, at a time like this, in the middle of a pandemic, it'd be best if you can work from home virtually. Public health officials have been recommending that companies encourage their employees to work from home in order to prevent the potentially deadly virus from spreading around offices. But certain jobs just can't be done virtually while being distant from others. And to people like workers here in this office, remote work is just not an option. So I'm going to share something very interesting. I'm sure you might have already noticed the difference about this place. So you will see that all the desks are closed by all of these transparent plastic partitions. So they even like small rooms on their own, right? So I'm going to talk to one of the workers here and find out working inside these cubicles is like, and find out what's all this is about. So, knock, knock. Can I bother you for a moment? Okay. Hi. So I see all these plexiglass barriers everywhere. So what is it like to work here?
Well, yeah, so the plexiglasses that you see is a part of our new initiative at Daesung called Clean Space. And it's been a pleasure to work in it. So essentially, Clean Space was designed to prevent viral transmission between our employees, and a sterile environment is maintained inside these spaces as a steady amount of purified air comes in through an ultra-pure filter and our exhaled air flows out. The millennial generation of employees have especially enjoyed working with Clean Space as it provides us with a creative and individualized place to work. Looking ahead into a post-COVID world, we are very excited for Clean Space as a bold new vision for the future of office.
All right, thank you so much for your answer. Thank you. And can I have a look around your cubicle for a moment? Thank you so much. All right, so this is the filter that she was talking about. Well, what I wanted to mention is that the room here, the cubicles, are at positive pressure room. We've heard of negative pressure rooms at medical facilities, right? So by changing the pressure inside this space allows the air to flow in just one direction, and the filter on the ceiling will push air down, not up. So what happens is contaminated airborne particles will have to go through this filter, which means the air inside the cubicle will remain clean, and I can take off my mask while working inside here. How wonderful is that? That will make my job so much easier and so much more comfortable. Well, the modern corporate office is renowned for open, collaborative workspaces. However, with a contagious virus lurking around, no one wants their office to turn into a petri dish or a hotbed of disease transmission. So I think these plastic walls will be the perfect solution, allowing workers to be present at the office while interacting with others. And most importantly, they'll be protected from airborne viruses. And thanks to this wonderful invention, no one has been infected with the coronavirus here at the company so far. So why don't we talk to the genius behind this brilliant idea? Hello. Good afternoon, and thank you for joining our show. So how did you come up with this brilliant idea?
Yes, Daesung developed this clean space in response to the coronavirus pandemic. Daesung operates power plants, gas station, and a hotel, and its business model is difficult to adopt, working from home. Therefore, Daesung has Daesung has 40 years of experience in manufacturing ultra-pure filters, and based on this proven technology, the clean space is designed to provide employees with safe and virus-free work environment.
All right, thank you so much. That was Ms. Robin Lee. Thank you for joining our show. All right, so small things truly make the big difference. And as the pandemic is likely to stay here for a while and have a lasting impact on personal habits, I'd like to really wait and see if the future office may look like this in a post-pandemic world. This is Chun Sung-cho reporting live from Gurogu District in Seoul, and back to Sunny in the studio.
Right, Sung-cho, looking quite safe there. All right, thank you for that coverage. Right. Now, as mentioned earlier, we have details about our own vaccination campaign, which is expected to start as scheduled next month. For more on the information that have been disclosed, I have Kim Sung-hyun here in the studio with me. Welcome, Sung-hyun.
Good afternoon.
Right. So medical workers will be first in line to receive the vaccines, I hear.
That's right. The government unveiled its phased vaccination plan yesterday, as we know. And the Korea Disease Control and Prevention Agency, or the KDCA, announced that frontline medical workers assigned to treat COVID-19 patients, they will be the first to get their vaccines. Now, the free nationwide vaccination campaign is set to begin late February, and the government announced that emergency care workers treating COVID-19 patients at designated hospitals in the Greater Seoul area will be receiving their first doses next month. The authorities estimated around 50,000 medical workers will be vaccinated, followed by another 780,000 people, which includes patients at mental health centers and long-term care facilities during the first quarter of 2021. The government said starting in mid-March, medical workers at general hospitals with a high number of COVID-19 patients will begin receiving their vaccinations. As for other COVID-19 first responders, such as paramedics and contact tracing personnel, they will also be subject to inoculation starting in mid-March, with their headcount numbering at around 440,000.
Right, Sung-hyun, all that to take place in the first quarter.
That's
what
correct.
about the second quarter?
Right, so starting April, elderly citizens will begin getting their shots, meaning those aged 65 or above will be getting their turn to receive COVID-19 vaccines. Now, the vaccinations will also be distributed to residents and staff members at high-risk facilities providing care for the elderly and the disabled. The number of people in that population bracket is estimated to be around 9.4 million. The KDCA added that a total of 380,000 healthcare workers working at community health centers and pharmacies across the country, they will also be eligible for the vaccination starting in the second quarter. And also during this time, those working and taking refuge at homeless shelters will be given their shots.
I see. What's in store for the rest of the year then?
Right, Sunny, basically a much wider segment of the general public we are talking about. So the greater population will be inoculated during the latter half of this year, according to health authorities. Now, starting in the third quarter, vaccines will be provided to those suffering from chronic diseases, as well as adults aged between 18 and 64. Military and law enforcement personnel, along with other essential workers, will also be getting their shots at this time, as well as workers at daycare centers. Come the fourth quarter, vaccines will be administered to people who are still waiting for their second dose, as well as those remaining who have not received the vaccines at all. The KDCA said the country aims to vaccinate 70% of its population to reach herd immunity by November.
The plan is to quickly scale up our mass vaccination program in the third quarter with the goal of achieving herd immunity.
However, pregnant women as well as children and adolescents under the age of 18 are currently not included in the vaccination campaign as the government continues to monitor for possible side effects. But they may be eligible in the future if future studies do demonstrate that vaccines are safe to be used in pregnant women and these minors.
Will there be enough supplies?
Right, hopefully so. It does look like there will be enough vaccines, Sunny. In fact, the KDCA has reassured the public that the country does have enough vaccines to go around for its entire population of 52 million. Now, the government has already secured enough doses to inoculate 56 million people through an agreement with the COVAX facility and separate contracts with 4 global biotech firms as well. Now, the KDCA also said it is close to signing a contract to secure additional vaccines for 20 million people from U.S. drug manufacturer Novavax. The authorities said 1.5 million out of the 10 million AstraZeneca vaccines will be the first ones to arrive in Korea late February. Now, this will be followed by around 6 million vaccines by Janssen and another 20 million from Moderna in the second quarter, followed by 10 million Pfizer vaccines in the third quarter. Now, vaccines provided by Pfizer and Moderna will be given at state-run vaccination facilities, as both products require ultra-cold temperature storage. The authorities said they plan to build around 250 such facilities at general hospitals, gymnasiums, and other public spaces across the country by July of this year. Meanwhile, vaccines by AstraZeneca and Janssen will be provided at around 10,000 private hospitals or by traveling doctors. And shortly we'll have a panel of experts discussing in more detail about the vaccination campaign. So do please stay tuned for that.
Yes, we will, Songyeon. All right, as always, Songyeon, thank you very much for that coverage.
The pleasure is mine.
Right, on the international front, Israel's vaccine drive against COVID-19 is the fastest in the world, with almost a third of the population there having received their first shots. What's more, studies there show Pfizer's vaccines offer substantial protection. I have Professor Cyril Cohen at Arirang University live on the line. Welcome, Professor Cohen.
Thank you for having me.
Professor, do start by telling us more about the findings with regard to the efficacy of the Pfizer vaccines.
Yes, so we have initial data that actually can show us that the Pfizer vaccine is starting to kick in, meaning that, for example, we have some updated data that showed that out of, for example, a sample of almost 250,000 people vaccinated, this is only a sample, we saw that there were only 66 cases of COVID-19. And if we compare that to a sample of the population non-vaccinated, we can see something like around, I would say, 15 times more infection, meaning that, based on our calculation, we do see an efficacy of around 90 to 95%, which is actually for us very, very good. Right now, as you said, a third of the population in Israel has already got its first dose, and half of them already their 2 doses.
I see. That's quite encouraging to know. Professor, in the case of the very few patients who were infected after being vaccinated, how do their symptoms compare to those of people who were not inoculated?
Yeah, so right now, based on that study that showed, I would say, a rate of infection of 0.02%, more or less, we have seen only, I would say, mild cases, okay? So that is also encouraging. And right now, what we are also seeing in hospitals, though we have, some problem right now because it's a bit overwhelmed, but we're still managing the situation. What we are seeing is that there is a decrease in the 60-year-old plus population in hospitals, and we believe that this might be because of the vaccines. Right now, I have to say that more than 80% of the 60-year-old plus population is already vaccinated.
I see. Meanwhile, Professor, what are your thoughts on efforts to battle coronavirus variants through booster shots? Do you believe this is a feasible plan?
It might take some time. The initial data we got from Pfizer and from other, and also from Moderna, is that the vaccine should protect from the British variant, which is a main problem right now in Israel because, more than 50% of the contamination is spreading very, very, very fast, I have to tell you, due to this British variant. So we are encouraged by the fact that based on studies, the vaccine should be protective against that variant. So this is the best news I can tell you right now. Regarding the Brazilian and the South African, we are waiting for more data. We believe that the South African might be also sensitive to the vaccine to some extent, perhaps to a full extent.
Right. Going back to the studies, Professor Cohen, on vaccine efficacy in Israel, what are the implications of the findings thus far, and what remains to be further explored?
I think that the biggest question right now is whether the vaccine can prevent transmission or not, because we are always talking about herd immunity, reaching herd immunity. But again, you have to take into account that herd immunity is really dependent on those vaccines preventing transmission. And that's what we're trying to ascertain right now, because it's not sure. I'm not saying it's not happening, but again, we have to have solid proof for that. So that is the main question for us, which might dictate our, I would say, vaccination strategy for the next few weeks.
Professor Cohen, you also serve on the advisory committee for COVID-19 vaccines in Israel. Speaking from that capacity, how are authorities there working to dispel public concerns over vaccines?
So it's a very interesting question, I have to say. I'll tell you the truth. Originally, around 30% of the Israelis were willing to get the vaccine, right away. Around 40% were kind of hesitating, and we had also 30% that didn't want to get the vaccine. And right now, the numbers are actually that 90% of the people in Israel want to get the vaccine, and around 10% are reluctant to get the vaccine. And I think it was because of three reasons. One, it was because of a lot of information, trying to explain to the public what the vaccine does and what are the potential risks and the benefits. The second thing, I think, was that people could see, for example, that, you get the vaccine, and if you were hesitant and you see people getting the vaccine and it's not, a catastrophe, on the contrary, people can get protected. So this helped convincing people. So I have to tell you that even if at the beginning people are hesitant, just give them some time. And I think the third thing is really a family thing, a sense of family, which is very strong in Israel. People, especially the elderly, want to embrace their kids and their grandkids. So this is, I think, the best motivation we have right now.
I see. Meanwhile, Professor, Israel has opted for a lockdown and border closures to battle COVID-19. Now, tell us a bit more about these measures, which I believe will end this coming Sunday.
Actually, we are in discussion. We might extend that for a few more days because of the variant. We believe that this is because of the British variant. We haven't seen the decrease we were expecting to see due to those measures. We are under a kind of lockdown. Most of the people can go to work, but we have no schools, unfortunately. We have no, I would say, places of gatherings and restaurants and I don't know, I would say movie theaters and things like that. So, we are trying to battle that. It's not easy. I have to tell you, it's not easy. We were negatively surprised by the extent of the spread of that variant. It's a problem right now.
I see. All right, Professor Cohen, thank you very much for making the time to join us live at this very early hour with your thoughts.
Thank you very much. It's my pleasure. Keep safe.
이제 한국은 코로나 극복의 단계로 진입하며 포용적 회복과 도약을 목표로 하고 있습니다. 그 시작은 다른 나라들과 마찬가지로 집단 면역의 첫걸음이 될 백신 접종이 될 것입니다.
예방접종 순서는 코로나19 감염 시 중증으로 진행될 위험이 높은 고위험군과 의료와 방역체계 유지에 필요한 필수 인력, 그리고 코로나19의 전파 특성 등을 고려하였으며 피해 사례에 대해서는 예방접종 피해 보상 제도에 따라 국가가 치료비, 간병비, 장애 및 사망 일시 보상금 등 국가 보상을 시행하도록 하겠습니다.
Authorities have disclosed details about their vaccine drive, including their priority list as well as timings. Now, the goal is to achieve herd immunity by November this year. For more on these intentions, I have Dr. Alice Hyungyang Tan from Ms. Medi Women's Hospital. Welcome back, Dr. Tan.
Thank you.
And I also have Dr. Yu Byung-uk from Soon Chanyang University Hospital, who is also a member of the Committee on Immunization Practices here in the country. Welcome, Professor Dr. Yu. Now, Dr. Yu, do start by telling us what our priority list is based on.
Well, first priority is how to cut down the death rate first. That's why we are suggesting the high-risk group in the long-term facilities, and also clinical care workers in the front line. They should be considered first, as we are thought, because this thing is already announced at the beginning of this year from the government. Wherein I believe this planning is done, and a little more detailed yesterday announced. I believe it will be carrying on for first target, how we can cut down the death rate and how we can protect the medical professional, not only doctors group and all who are front line in the critical care.
I see. So those in the front lines have been put among the first to receive the vaccines because I suppose of their crucial role in fighting the pandemic.
Absolutely, as well, because from the beginnings of the COVID-19 pandemic in United States first, you can see the many news, many nurses, doctors, and infected. Also, they are never rescued from the COVID-19. So, medical professionals should be protected who are frontline. It's like a national medical center in Seoul metropolitan. They should be considered first. The doctors group and the nurses group should be, and then we can take care of the other three, the hospital located in Chungnam and Jeonnam and Busan, which is already assigned as like the infected specialized hospital and the center in the province. These four will advance first for the 50,000 people have been vaccinated for first quarter of this year.
I see. Meanwhile, Dr. Dan, most COVID-19 vaccines, with the exception of Janssen's, I believe, require 2 shots. What happens if you get COVID-19 after your first shot? Do you still get your second shot? Do we have any studies on the safety of vaccines if they're administered to people who have COVID-19?
So the recommendation is that anyone who has recovered from a natural infection of COVID-19, that they should still get vaccinated. And the same is true if someone gets COVID-19 after receiving the first shot. They should get vaccinated as well, but the timing should be such that they don't get the shot during the acute phase of the illness when they might have a fever or when they might be infectious. We should wait until those acute symptoms have passed, and of course the period of infectivity has passed as well. In terms of questions of safety, we do have data from AstraZeneca, Pfizer, and Moderna vaccine trials in which, because the vaccines were not 100% effective, right, in which people who received the vaccine also got infected. And we know that in that population, the severity of the disease was not any higher than people who received the placebo or comparator groups. And so the protocol right now is even if you've been infected, you should still get vaccinated.
Right. Dr. Dan, the public here will not be given the option to choose their vaccines. What do you suppose is the rationale behind this government decision?
Well, as Professor Yu just said, our set goal of the vaccination campaign is to decrease deaths, also to protect healthcare workers and keep our healthcare system viable. And then lastly is to prevent the spread of the disease in our society. We do have enough vaccine to vaccinate all the adults in our country, but globally speaking, vaccines are in short supply. And the contracts, as they stand, are for our country, for us to receive certain amounts of vaccines, batches, during certain periods, quarters of the year. There may be multiple vaccines available, say in quarter 1, quarter 2, but in terms of safety and efficacy in the adult population, they've all proven to be fairly equivalent. And so in order to maintain an orderly rollout, that's why the government is designating which groups should receive the vaccine at what time. Every individual will have the choice to either accept or decline the vaccine. I mean, it will not be forced on them. So that option is there, but they will not have the option to choose which vaccine.
Right. Dr. Yu, among the first shipments of vaccines are those from AstraZeneca and Pfizer here in Korea. Now, in the case of Pfizer, there are stringent storage requirements which have called for the construction of temporary vaccination sites. What are some factors to keep in mind to ensure the proper operational setup of these temporary centers? Well,
months before, the Dr. Jung Eun-kyung, the head person of CDSCH, she announced it already. We are now processed to having the 250 of the strong storage for as like the refrigerator can be the setup of the 250 center for Moderna and the Pfizer mode of vaccination, because it requires at least less than 70 Celsius under or less than 20 Celsius under. So which is that we need the time to set up and reconstruct it. But still now, we don't have any special idea about it. But fortunately, each general hospital, in the higher level hospital, tertiary level hospital, and the university affiliated hospital, they have it. Also, we can use some public gym, like we are open for the volleyball and the soccer played, but in the indoor, we can return into the COVID vaccination center immediately. So as well, yesterday we have the new scenes compared to last year. We are vaccine campaign against just a seasonal flu. You can see the military uniform yesterday, which means this unknowns and the performance give the people get the more confidence. Because last year we have a certain happening, cold chain issues. That's why people that didn't believe 100%, even 8% less vaccinated than 2018 about the flu vaccination in 2019. But yesterday that performance, I believe they will do well. The cold chain at the same time, military special transport system and team will take care of the transporting and deliver the vaccination. Probably it will guarantee the safety and the efficacy of vaccination.
Right. Hopefully, we'll keep our fingers crossed for that. Dr. Dan, German media have questioned the efficacy of AstraZeneca's vaccine for those above 65. Now, AstraZeneca, for its part, has dismissed these reports, saying they're incorrect. What are your thoughts?
Well, on December 8th, the study results from the AstraZeneca safety and efficacy trials was published. And in that report, even the trial, the researchers admitted that the number of people who are in the older age cohorts, people over the age of 70, the numbers were small. So in the UK, there were only 213 people representing about 10% of trial participants who were in that age group by the time that the study was published. Also in Brazil, the same thing. There were only 11 people who were aged 70 or older who had received the vaccine, and that represented less than 1% of the people who received the vaccine in that country for the trial. So, even the company admitted that the efficacy data would be limited for that age population due to small enrollment in that cohort. However, they did refer to a study that was published 1 month prior in November, which showed equivalent safety and what's known as immunogenicity in all adult age groups. The young, middle, and older age adults. So we can't prove that the immunogenicity data are exact correlates of protection, we say. However, we have a good idea that they probably will be. Also, the trial that was published in December, that was an interim report. So the trial is ongoing, and the pharmaceutical company has assured us that once more of the older population is enrolled, the recruitment started later. So once they have more people enrolled in that age population, that they will provide more results. So I understand the concern. And the company itself admitted as such, during the trial report. But I don't think we need to totally discount the vaccine as ineffective in older people.
Right. And staying in Europe, Dr. Yu, the continent that is experiencing delivery delays amid production problems. Do you see Korea perhaps encountering a similar plight?
It can happen everywhere. So Italian ministers announced last week about claiming to the certain pharmaceutical companies to be delayed from the US to the Italy. Only 23% is being delivered than compared to the contracted, because the one accident happening, the fires in manufacturing in the India it can be affected and delayed. But one of the good news is the pharmaceutical company in Korea contracted and producing in domestics in Korea with the AstraZeneca Modern 1. As well, Novavax is not delivered yet and not contract yet, but also Novavax, they don't have the factories. That's why they have been contract in also one Korean pharmaceutical companies already. So could be a little bit delayed, but there can be matching of the amount which is contracted. But time delayed can be happening in Korea too.
I see. Meanwhile, Dr. Yu, Korea is planning to create a vaccination registration system. It will include important information as well as allow people interested in getting vaccinated to set up appointments. What must be considered to ensure that the system runs efficiently?
Well, first of all, I'm around 50, but I'm very difficult to use a mobile banking system, even for I feel very young, which means it's very difficult for me because I'm old thumb of the mobile and IT. But we are beginning of this. We are talking about who going to have the first priority, aged people most likely, and who are better people who are not used to the IT, but probably who need help to register this system, and also help to the deliver to have the vaccination. So this is kind of big issue. And the second issue, usually I use the KTX line. It's very useful, but if we are no-show or we delayed it, we give the penalty. So no-show issue is very important, especially the Moderna and the Pfizer Moderna one, because it's the lead, pool storage system compared than AstraZeneca and Novavax and Janssen one. So which means when it start to the melt, to prepare in a 4 hour, let me say, when we have to have fresh one, when the time's gone, it's useless. So for example, Pfizer one can melt for the 5 person, or squeezing make for 6 person we can use it, but if you no-show or delay it, useless, not only useless, take an opportunity from some other persons. So no-show, the regulation should be prepared, as also at the same time, the aged people, how to easy to register it. Because if you open only over the phone, probably phone on the fire. Always the online was busy. So we should be to consider about the aged people, how to access and how to deliver the out. And at the same time, the no-show rule should be made before we started.
Right. Dr. Tan, authorities are hoping to inoculate 70% of our population by September. Is this a feasible plan? And what perhaps can be done to tackle possible contingencies, do you think?
So we have a situation that we have tens of millions of people who may have to wait for several months before they get their vaccine. And there are some potential problems that could arise because of this long wait, this long line that's going to form. And one is the issue of black market vaccines. And this is something that's been brought up by multiple media outlets throughout the world. It's happening here in Korea as well. And of course, the problem with black market vaccines is safety, first and foremost. I mean, you don't know what's in the syringe of a vaccine that's not been authorized. It could just be saline solution, which means it's ineffective. But worse, I mean, it could be contaminated, it could be poison, who knows? This kind of market totally undermines the trust that we absolutely need to get good uptake of the vaccine. And so as tempting as it may be for people to try to get priority for vaccination, this cannot be allowed whatsoever. The other question is the durability of immunity. We have data that prove likely durability of immunity for the Moderna vaccine up to 90 days after the second dose. But there was a study that showed that immunity after natural infection tends to wane after 5 months. So the question you asked before, the need for a possible booster, I mean, people who get vaccinated this winter and spring, will they need a booster in the fall or winter? That remains to be seen. And then another question is, what are we going to do about all the people who are participating in vaccine trials that are currently under development here in Korea? I mean, it's not ethical to deny them a chance to get vaccinated. And yet, we have a strong motivation to keep, trying to develop domestic vaccines. And so these are all issues that will need to be dealt with as we move along.
Right, we do. Now, the plan, meanwhile, is to vaccinate the majority of people by September and to achieve herd immunity by November. The question then is, will this scenario end the pandemic? That's what we asked Professor Roston and Tia at Emory University. To take a listen.
The research was done, it was a modeling study. So what we did was we looked at the characteristics of the circulating coronaviruses. And COVID-19, as you know, is relatively benign. It usually causes mild symptoms in the young and is really much more severe in a fraction of older people. What would happen, we found, was that it would infect people when they're young, when they get mild infections, and it's not really a problem. And the immunity they generate upon those infections would prevent them developing severe disease when they get infected when they're older, which is possibly like what's happening with the circulating human coronaviruses. For measles, for example, once an individual is immune, they can no longer get infected. It's slightly different for circulating human coronaviruses. The immunity we get to circulating human coronaviruses, it appears it doesn't prevent you getting infected and transmitting, and that's what we found in our analysis. It simply prevents you getting ill. When COVID-19 in 5 or 10 years from now has swept through the population, and when we are all immune to it, then the only new infections will be in the young. They'll be relatively mild infections. And as these people age, it's at least possible or likely, if it has the same immunological characteristics as the circulating human coronaviruses, that subsequent infections would be mild infections, so that by the time, people getting infected when they're old will have protective immunity that at least protects them from bad symptoms. While it might not prevent them getting infected, it still will prevent them from getting ill.
Right, given what Professor Antia has just said, it sounds like it's going to become an endemic in the future then. Meanwhile, Professor Yu, authorities have vowed to fully compensate those who suffer from side effects that are clearly linked to the vaccines. Is this stance sufficient enough to perhaps ease public reservations about the safety of COVID-19 vaccines?
Well, before answering this question, we have to review about the history in Korea. How many people have this compensation benefit? Before 2019, only one person. Only one person are clearly linked after the vaccinations, something happened. But the last year, now it's under investigated, probably some more than one who got it. So it's very difficult to clearance of the link to vaccination and a side effect. But I'm very welcome that I can answer about your question. I'm very welcome about this announcement from the KDCA, because this will open the people feel sure and feel safety and go forward having the vaccination involuntary. But anyway, we have to make clear the guideline and criteria and with the transparencies, because if vaccinations is for the people who are healthy, get the more health promote. That's why it can be upset more than who are sick after vaccination. So anyway, we have to open the criteria so they can be understand, even not the medical professional, as a people in the common can be understand what happened exactly. That help the people go forward having vaccination in the volunteers.
Right. Transparency is something that Professor Cohen in Israel also mentioned.
Yeah.
Dr. Tan, what do you propose then to boost public support for our vaccine drive?
Well, there can be some fear, in the public, and that's a very natural human response to things that are unknown or unfamiliar. I think we need to counter any hesitancy or fear with the truth, transparency, as Professor Yu said, reason, facts. I think we need a lot of public engagement and outreach, leading by example, perhaps, and engaging community leaders to get people on board with this. Yesterday's press briefing was very interesting, but they did state, law enforcement officers stated that misinformation, deliberate misinformation regarding the COVID-19 vaccine will be considered a crime and will be punished as such. I think that's very important to take that strong stance. I would say that the WHO, the United States FDA, and also the Korean Ministry of Food and Drug Safety, these are trustworthy government institutions. And so products that have been approved by these institutions can be trusted by the public. And also the vaccine trials for the EUA approved products, these trials are still ongoing. They will be carried out for 2 years. And so if there are any safety signals that arise, while we are still vaccinating, these signals will be made known to the oversight committees, and I am sure the public will also be made aware of them. So there are many layers of safety built in, and I hope that people will feel comfortable about getting vaccinated.
Right. Dr. Yu, despite the vaccinations, though, in Europe and the US, their numbers of infections, like we saw earlier on the program, remain quite high. What are your thoughts about this?
Well, vaccine is one of the options can be the prevent to spreading, but the keeping social distance and the wear of masks and the personal hygiene protection and be aware about the COVID-19 is more important in this moment because, like I like to say, vaccination is like now toddler, just start to work. So it's not covered all of the situation like the pandemic COVID-19. So Korean people also, I like to say, and who are dear to this, the Arirang, the audience who live in Korea, in overseas, vaccine is kind of the first step against COVID-19, unknown from the human being to the virus. But still, now virus still in the battlefield, they're still winning against the human beings. So the vaccine is one of two fight against COVID-19, but is that not enough? So we are willing to have vaccine is enough to all together more than 70% all global citizens. That time probably start to decline a number of patients, but not yet now.
I see. All right, Dr. Yu, as always, thank you very much for your thoughts. And Dr. Tan, thank you for your insights today.
Thank you.
Right, well, come this weekend, authorities will announce their guidelines for social distancing ahead of the upcoming Lunar New Year holiday next month. Now, in the meantime, as Dr. Yu and Dr. Dan have said, do seek to abide by these safety precautions as we wait for the start of our own inoculation campaign. Thank you for watching.